Eye on Health, brought to you by Tallahassee Memorial HealthCare.
After a spinal trauma event, the team at Tallahassee Memorial HealthCare treats patients to ensure the best possible outcome so the patients can begin to resume their normal activities as quickly as possible. Here to talk about spinal trauma is Dr. Adam Oliver. Dr. Oliver, when I hear about spinal trauma, I think of broken backs, I think of paralysis. What does the neurosurgeon have to do with that?
Neurosurgery not only is focused on the brain and spinal cord, but also on the structures supporting that neural anatomy. And so the spinal column and the integrity of the spinal column is critical to supporting the spinal cord. And so a lot of the fractures that we're seeing are not necessarily going to need an operation. However, for the preservation of your neurologic function, as well as controlling pain and stability of the spinal column, operations are sometimes necessary.
Why is it important to get to a trauma center?
Trauma center designation means that your hospital has met the criteria to be able to take care of complex trauma patients. Spine is just part of that. However, the global patient population and all of the problems that come with that trauma, spine is part of it, and being able to get to a place that can handle all of those problems is important in your recovery.
What's your best advice on how a person can help avoid spinal trauma?
Don't text and drive, don't drink and drive, have your bone density checked, and don't smoke.
That's good advice.
Yeah.
Simple.
And
Use common sense.
use common sense.
Thank you so much, Dr. Oliver.
You're very welcome.
To learn more about spinal trauma treatment at Tallahassee Memorial HealthCare, visit tmh.org/neuro.
Eye on Health, brought to you by Tallahassee Memorial HealthCare, your hospital for life.